This is the Transparency Podcast Show.
I'll say a couple of words. I don't want trans men to feel left out.
Okay.
Because we do, I do stuff for trans men too. Mm-hmm. Usually the ratio in my practice and in most practices, there are going to be more trans women than trans men. Trans men are also less surgically geared. Yes. They're the most common surgery is top surgery. Top surgery is the removal of breast tissue. Mm-hmm. It's changing, and actually a lot of the vaginal surgery is changing too. So we're getting, some people are coming in for zero depth vaginoplasty, where they don't really want depth, they just want the exterior look of having a vagina. Some people are coming in for nullification surgery, where they don't really want to have labia, let's say, and the look of a vagina. They're really looking for more of a Barbie doll appearance. Mm-hmm. I've had a couple of people now coming in who want to maintain their penis and have a vagina as well. So they want to have, let's say, 2 sets of or additional ammunition and equipment. Yeah, everything. Wow. If you can think it up, I usually can do it. Wow. It just becomes, and actually those, I have got a few people who are waiting right now for their insurances to determine whether they'll allow pay for this stuff. So trans men. So and in the top surgery, some people are coming in, they don't want their nipple areola placed back on. They want some scarring done differently. There are some scar choices. And those things probably are best talked about at consultation, because there are different choices. You can do a small scar, you can do a T-shaped scar, you can do a double incision scar, and these will all be patient dependent. Right. And then when we get to, let's say, genital surgery for trans men, it becomes much more complicated, because getting a penis to work is hard enough for natal males. Getting it to work is to me, the whole erection and penises are kind of a miracle. Yeah. So that's a tough one, but a gold standard, I'll just say quickly, is a forearm flap. It's a microvascular technique, and we're looking at probably at least three surgeries, and most people will have more beyond that, because complications are very frequent, including fistulas, and that's a urinary problem where the urine doesn't come out the tip of the penis, and so there are issues with that, but that's available.
Okay, very good.
And masculine surgery. Also, I've got patients coming in now. Some of them want pec implants to try to get more musculature. So there are always changes happening in what it is that I do, and I try to be responsive and listen to what my patients are saying and give them what they want.